The infection risk is slightly higher when using silicone implants, and therefore the risk of contracture is also higher. In contrast, when using autologous rib cartilage, there is almost no risk of contracture. The second main difference is in terms of resorption. When using a silicone implant, there will almost be no change in the height of the implant over time, so it's easier to determine the final height of the nasal dorsum. Hi everyone, I'm Dr. Han. I'm a board-certified plastic surgeon working here at Kirin Plastic Surgery. I usually do blepharoplasty and rhinoplasty. I would like to explain to you the difference between using rib cartilage or using silicone implant for augmentation of the nasal bridge. The first difference is in terms of safety. The infection risk is slightly higher when using silicone implants, and therefore the risk of contracture is also higher. Contracture is a deformity that is characterized by shortening of the nose and upturning of the tip, which is also known as piggy nose. In contrast, when using autologous rib cartilage, there is almost no risk of contracture. The second main difference is in terms of resorption. When using a silicone implant, there will almost be no change in the height of the implant over time, so it's easier to determine the final height of the nasal dorsum. Whereas with rib cartilage, there will be inevitably some amount of resorption over time, which means that the nasal bridge will become a bit lower than the immediate postoperative point. So I take that into consideration and I overcorrect when using rib cartilage. The third main difference is whether it leaves an additional scar. With silicone implants, it leaves no additional scar other than the one used for the rhinoplasty itself. Whereas with rib cartilage, during the process of harvesting, it will leave a small linear scar on your chest. Okay, so the best shape for nose implant is the one that will get you the nose shape that you want. And it is up to the surgeon to select the implant that will fit nicely to your nasal bone and at the same time produce just the right amount of augmentation at each point of your nose. Yes, you can get rhinoplasty even if you have allergic rhinitis, which is nose allergy. However, the recovery period may be a bit more challenging for you if you have allergies because rhinoplasty can temporarily worsen your allergy symptoms such as runny nose or sneezing. If you have to get rhinoplasty during your allergy seasons, then it may help for you to take your allergy medications to alleviate these symptoms. And sneezing too often during the early postoperative period may also become a problem, and it may cause some unwanted problems because sneezing too often elevates the pressure inside your nose. So I usually advise patients to avoid their allergy seasons when planning rhinoplasty. Most patients experience runny nose or stuffy nose after surgery. This is a symptom that is caused by swelling of the nasal mucosa, which is the inner lining of your nose. The symptoms usually go away within 1 to 2 weeks, but in rare cases, it may last up to 1 to 2 months. This really depends on the person. Thank you for watching. I really hope to see you at our clinic in Korea.